Hello my dear ones. I hope that last video helped you in regards to understanding these 4 stages that we go through. And no matter whether you're diagnosed with a cold and flu-like symptom, acute manifestation, or you're dealing in subacute, mumps, measles, things like this. You're dealing in chronic areas of arthritis, fibromyalgia, lupus, Lyme, some of these deeper. And be honest with you, to get to chronic levels, you have to suppress the first 2 levels. And one of the most favorite tools of the allopathic community to suppress acute and subacute manifestations is antibiotics. And so, antibiotics, the wonder drugs, they stopped a cold and flu-like symptom. Really? Do you want to stop a cold and flu-like symptom? When you truly understand what created that, you, and the fact that you were consuming mucus-forming foods and you want to stop your body from cleaning that out? Do you really? And that's the problem. They've been more responsible for these deeper levels of problems. We used to never have that. Man's body cleans out acute manifestations and subacute as you live. But since man started using pharmaceuticals to suppress the symptoms, to treat the symptoms, this has driven all these stages deeper and deeper and deeper to now we have extreme chronic levels and degenerative levels. You didn't see it, nothing like we do today. And it is on one reason, is we treat these manifestations of acute and subacute symptoms. And you can't do that. That's why detoxification has always been that golden key that unlocks the mystery of man's suffering. And when you look at it and you understand it, it just fits in like a glove. It all totally makes sense. You understand how you created everything and simply how you reverse that. That's simple. That's all it is. Now, I was given this, please return to Gen B. Let me see here. Josh, thanks for the comment. Yeah, he got some milk jug plastic, as he calls it, out of his bowels. And, that's the point. And, of course, you're going to have malabsorption when you see this plaquing stuff on the bowel wall. And as it comes out, gluten, and all these factors that we consume, and dairy products with gluten. Imagine milk with white flour with meat. What that can do to your gut as you plaster those proteins on that bowel wall with a piece of chewing gum called gluten. I mean, you're going to burn back that mucosa, and they're going to create a lot of mucus from the immune response or the mucosic response to that. And then, of course, in time, you'll pocket in that bowel area and create a diverticulum. But good work, my friend. Yeah, I said there's two words that describe what you do to be well in today's world. You clean and you strengthen. 2 simple words. Clean and strengthen your body up. All right, now she's waiting on an appointment. Okay, so let's see. This is kind of a long letter here. Oh, but we have eyes. We have eyes and we have ugly pictures. Uh-oh, honey. I can show this up on YouTube. Address it's on YouTube or private video. Well, as long as you don't care, I won't mention any names then, okay? Dear Dr. Morse, I want you to look at my case if you don't mind. It is a long one. Sorry in advance. I am a 37-year-old female. All right, I have 3 kids. And this is a long story of so many of you out there. You're beautiful ladies who got stuck with, raising your children by yourself. And I'm hoping that this current administration is going to take steps to help that even more. I have too many health issues. I will list them by order and in which age it started. 7 years old. 7 years old. Depression. So immediately, this could be a baby that came out of a mother with a parathyroid weakness, meaning this baby could have, as we read, let's see what we can pick up here, but this baby could have had not a baby anymore, of course, but could have had parathyroid issues of all kinds. You can have major headaches, spasticity, low neural performance, all kinds of things with low calcium utilization, and depression being one of them. 10 years old, cellulite, spider veins. See, here's the spider veins creeping in. In other words, you see the depression. You know, depression is directly caused from a lack of calcium utilization. So what else happens in an acidic sky? You start losing calcium. Remember the calcium buffering system. So you start to lose calcium, but then you can't put it back because you have a parathyroid weakness. So now it's a matter of time where you see the spider veins, the varicose veins, the bruising easy, the herniations, aneurysms, all these things tied to connective tissue weakness, prolapsing, that sort of thing. And I had sharp pains in my chest, which made it so hard to breathe. Ooh, at 10 years old? Holy crap. 12, fat, IBS, Crohn's, 18, severe panic attacks. Anxiety, depression is a part of my daily life. So here's a lady that had severe panic attacks is a neurological experience, right? And the neurological experience starts right at the adrenals with low neurotransmitters. Also the stomach area. She could have a lot of gastric problems in the stomach. A lot of acidosis, lymph stagnation interstitially, and of course this is the what? Brain of the autonomic. So this whole area in the gut could be creating pain in the chest, heart problems, all kinds of. Add on to that calcium utilization problems, that'll be low neurotransmission, more pain. I mean, and the loss of calcium out of structure as the body struggles to fight acidosis, that sort of thing. And if a medical doctor can't get that, maybe you better go back to a school. But what school are you going to go to learn that? That's the problem. Our school. I struggle to breathe normally, but now when your adrenals are down, remember breathing is a neurological experience. So when your breathing is down, your adrenal glands are down, plain and simple. And of course you could have gut-related problems too. Let me throw that in there. And this is serious stuff. You know, severe panic attacks and depression. Now, what we're seeing chronic adrenals, sounds like. We're seeing a parathyroid problem, right? She hasn't mentioned her height or anything. She's got 3 kids, so I don't know if she's been able to carry or had lost any children. I'm fishing for pituitary problems, right? Absolutely. Does she have menses on time every time? How tall is she? It just goes on and on with that. So to have IBS and Crohn's, your adrenals have to be down, which makes your kidneys down. So that means you're not moving your lymph system. So here's a lady probably born with chronic GI tract problems. Let's take a look. I've got eye picks. You want to see something? Take a look at this. You see that real black one? Pituitary, major, chronic, major, even to the point of slightly degeneration if you're not careful. And this is that little lovely twin, the pineal gland. She hasn't said insomnia yet, but it's possible. These little radius solaris are up in her head area. You got to get rid of them. Right down here, we're visiting adrenals and kidneys. See these? What else? Possible. It could be shading, could be skin. So what I see here in the right eye, I see and you can tell that, you know how you can tell that's a genetic? Because this big lacuna goes right into the bowel wall, and see how it's going right down to the pupil, right in the stomach. Embryo. These are embryonic weaknesses. Of course, all genetics are in its own way. So this is what I take on the right side of her body. She's got a very chronic pituitary issue, a chronic pineal issue, a couple of spots in the frontal lobe, not too bad. She got a little cerebellum back here, maybe mastoid. Looks like the left ear, the right ear is a little chronic. The mastoid and maybe a spot in the cerebellum. This could yield you equilibrium, dizzy, vertigo, that sort of thing. Definitely chronic adrenals, sweetheart. Definitely chronic adrenals. And also upper right femur that fits up in the hip, very chronic. And then if I go to the hip, it's less chronic, but it's still getting chronic on you. And that upper femur, be careful. That whole leg, right leg, is weak, but the upper femur is chronic. The kidney is chronic to subacute. I'm either looking at uterus or bladder, and there's some chronicness to that as well. I'm probably going to find a hysterectomy as we keep going here. All right, let's just take a quick look here. Uterus. See that chronic uterus, and also a little bit on the vaginal wall. Here we got tailbone, maybe coccyx. I think that's above the bladder. But outside of that, dear one, you've got pretty good genes. A slight pancreatic thing, but you've got some good genes here despite all of this. You got a little right shoulder thing, I think, going on there, maybe a little bronchial there. But you got hit hard in the endocrine glands, and you want to work on them heavily. You have very chronic adrenal on that side. You do have some nerve rings, not too many, but your pituitary's down. I look at your right thyroid gland. I don't see much going on there. I don't even see much going on in the parathyroid, maybe the tonsils. But you're pituitary driven here, and this pituitary is very hypofunctioning, and that was going to definitely suppress all the other ones for sure. So this has been, I don't know how tall you are, but this is a big weakness at birth. Okay, here's the left eye. Take a look at this. Look at all these radius solaris up into the head. More evidence of pituitary pineal gland. Take a look at the kidneys and adrenals. Chronic. So, here's a good gene person, but just the right tissues are down. Now, you got chronic bowels, that goes without saying. But your whole left kidney is chronic, your adrenal gland is chronic. The uterus is a little better there on that side, but the bladder picks up a little subacute weakness. Now, also, here's, again, your whole left leg is weak like the right one, but more so. The whole left leg is chronically weak, and that fits into a chronic hip. I got a little subacute weakness in the left ovary. But here is mastoid cerebellum involvement, left side, big time. Honey, from the center of the head back here, you got a lot of radius solaris, a lot of weaknesses back here. A little bit up in the frontal lobe. Upper circuit brain and nerve mandatory in a case like this, guys. Upper circuit brain and nerve. Also, I don't see any cholesterol plaquing on the right eye, I don't think. No, honey. No. You've got a lot of cholesterol issues here. You've got cholesterol plaquing all over the place, it looks like to me. I mean, these are so-so eyes, but look at here. Look at that translucent hue. See that translucent hue? These could be shadings, but I can tell you, there's a little translucent hue here. For me, without better picks, I'm going to highly suggest if you've had elevated cholesterol levels, you've got serious cholesterol plaquing going on, which equals poor circulation. Important to fix this up, dear one. Left shoulder also a little bit, I think. Well, let's see what else she says about herself. So now we know why. Now we know why the panic attack. We already knew the glands involved, but how much involved. And now we see, we got some, matter of fact, let me take another look here at the left side. Well, I can't see the thyroid, parathyroid on the left side. It looks like there's something there, but I can't see that. So look at your left eye, and the left eye is going to be about 9:30. Then you're going to see the left thyroid gland and the parathyroid close to the bowel wall. But certainly, in my opinion, it looks like from the eyes you have some cholesterol issues. I would be on upper and lower circulation, unless you have a tumor. Now, you've sent me a picture of what look like tumors. So before I say anything with lower circulation, but you could use upper circulation and brain and nerve, and I would. Now, this is a case where you're going to have to work on your pituitary. I would definitely use the endocrine gland formula, the pituitary formula, and you might, I'd have to see what your TSHs and all that's doing, but you might want to use a little pituitary glandular, a little light one, maybe 25 milligrams or something like that, just to give a little bump to those cells, because that is so chronic. I'm sure your pituitary gland is wondering what it all has to do. I struggle to breathe normally. I grasp for air constantly and I get tired easily. Well, you have very chronic adrenal glands. So you want, if it's me, I'm going to be on adrenal 400s. I'm going to be on at least one 3 times a day, if not 4 times a day. I might even add the adrenal herbal, and I might even add licorice root. How low is your blood pressure? Because in these levels like this, you start, remember, in chronic levels, everything goes hypo. In the acute to the subacute, it can be hyper or hypo. But we're dealing in hypo now. I mean, that the pituitary can't be hyper at all at this point. It is definitely on its way down. And the problem with this is what? She has 3 kids. And that's a problem. That's a problem for these children's growth factors. It's a problem for a lot of things, a lot of reasons. And they don't, we need to build a better world. That's all I can say. So when you awaken here, you can have bona fide help from another part of awakened God. My heartbeats are irregular. I'm not doubting that one little bit. You've got calcium utilization problems. You've got chronic lymphatic problems. I don't really see too many heart issues there. You got chronic lymphatic stagnation in the heart area. But your nervous system's down, your calcium utilization is down, your adrenal neurotransmitters are down, so why wouldn't you have heart arrhythmias? You have the setup for AFib almost. So you want to get those neurotransmitters, you got to get those adrenals up. To get those adrenals up is going to help you start breathing better. Asthma up. That's the beginning of COPD, chronic obstructive pulmonary disease. Basically, it's a neurological event. And you start to lose your myelin sheaths. As your nervous system becomes chronic, breathing is harder and harder to exhale, harder to take deeper breaths. At age of 34, after giving birth to my daughter, I started to get the pyroderma, gangrene, whatever that is. It is an autoimmune disease where the immune system eats its flesh. There is no such thing as autoimmune. So think again. If you take out diseases and autoimmune, which means your body doesn't know what it's doing, it's just hurting itself, wrong. What is it? What's going on here? And we've gathered by now we're dealing in extreme acidosis. And if you're born, your left eye shows very weak skin, a little bit of a skin ring on your right side. Weaknesses are what? This is something important. And why do I say clean and strengthen? Because weaknesses are terminated by nature. If they're cells or people, it don't matter. Nature terminates its weaknesses. Can't afford to procreate them because then we have an aberrant society. We have a mutated civilization. So God doesn't mutate if it can help it. But you're looking at the babies coming through, and a lot of sad stuff here, guys. Let's see here. Eats flesh, deep growing ulcers. This is just extreme chronic acidosis. Remember, we just got through talking about the 4 phases. In the chronic stage, you're getting chewed on. Your cells are going down. It's intracellular acidosis. So the medical doctor will say what they want, but you're in a degenerative state in some of these areas, and you're just going to get chewed on. Body's just going to get chewed on. I have it on my back for 1 year without diagnosis. No one knows the bleeding won't stop. When I had another one on my back in the left side of my body. If you get a bleeding problem that won't stop, get the bleeding formula here. It's a hemostatic. It'll stop internal bleeding. But bleeding is the body's effort. Remember, your body's trying to get rid of these acids. And bleeding is how the body does this. Bleeding is bringing an alkaline slurry into an acidic mix and trying to bring some type of ionization to that, some type of hydration to that, some type of neutralization or a pull toward the anionic side. Taking 40 milligrams of prednisone. Well, there goes your adrenals. They're already chronic, and now this is going to make them more chronic. That's the problem. So you've got some things to work out of here. You've got to, this is the case, dear one. I know you're waiting on Marcy. But you got to work with this. Now, when you're on steroids here and you want to get off of them, you got to titrate or have your medical doctor help you titrate off of them. They put you on them. Was the only answer to close the ulcers? It's not the only answer to close ulcers. Not at all. That's a medical way of closing ulcers. How do we close ulcers? We get rid of the acidosis. We get rid of the lymph stagnation. And that gets rid of the ulcers, the tumors, and everything else. You take steroids, you didn't get rid of the acids. All you did was go... After a while, that goes away, and the burn is even more aggressive. And at the same time, using a steroid, you lost your adrenals, so now your adrenals have even less ability to help you. It is a horrible nightmare, and a chain that medical doctors get people in that's a living nightmare. And most of you young guys and gals know that have been on steroids for the skin. Or for insane inflammation, which is simply insane acidosis. When you get that and learn that, there you go, you can see the heart better. Did a water fast after that first. I had 5 ulcers on my face and left side too. Again, your body is so acidic, you're ulcerating tissue at this rate, you're in trouble, honey, and you've got to get your kidneys filtering, and you've got real chronic adrenals, so you want to work on this. You want to go after those adrenals aggressively. I don't know what your blood pressure is, but you really want to go after that. And go after those adrenals so you can get better neurotransmitters up. Licorice root is the best herb for that in a fast manner. But yeah, you got some problems here. You got to deal with this and get these going. Holy moly. Because they were on my face, I had to take prednisone. I didn't want to have ugly scar. I get that. My skin is my weakness part of my body. Thin skin, cellulite, wound. But see, it's not just the skin. This is extreme acidosis, and remember, you cannot heal in an acid medium. And of course, you're going to see impactions of lymph fluids and of lipids. So you could get cellulite all over the place, lose your muscles, become real flabby. You just keep going on and on and on with deterioration of bone, everything else, because when you live a life without a parathyroid, chronic pituitary, I can't imagine you even being happy. I can't imagine you having happy menses without severe pain or irregular menses. I can't imagine any of this. Let me see. Cellulite wound usually don't heal fast. My birth surgery took a year to heal. So right there, for any intelligent being that is trained in the healing arts properly, that understands the two sides of chemistry, is going to say, too acidic, boom. And that should echo out of any of our mouths, and especially ours, because we're supposed to be the knowers, but particularly medical doctors should say, that's acidosis. But that's not where the situation is at this time. And yes, acids will scar you, no question about that. The ulcers are 8. I got through the 4 years. The doctors are angry. They want me to take prednisone for life. Because whenever I stop taking prednisone, the ulcers show up. Well, I don't believe a medical doctor ever told you, and if he did, or she did, that could be dereliction of duty. First of all, there is no curative value to using steroids or pharmaceuticals whatsoever. Remember, these are only treatment-based instruments. Toxic drugs that are used to treat symptoms, to try to make your symptoms go away for you. All under the cloud of diseases, which is totally a fabrication of the medical mind. Understand in real time what your problem is. We have chemistry and we have physics, and we have a lot of awareness in chemistry and physics to the point where we can explain to you the whole process and what's going on. But you haven't removed. None of this removes or detoxes these acids. None of these get your kidneys to filter again. None of these efforts that you have made enhance the endocrine glands. I was living on, here we go. I was living on antibiotics and all meds. Why? This is not none of this is a bacterial problem. It's a nightmare out there, guys. A nightmare. And so her stages keep getting pushed deeper and deeper and deeper. Any acute she's creating gets shoved into the subacute. The subacute gets shoved into the chronic. And you look like you're getting some degenerative changes in some of these tissues in the gut and in the pituitary area. Be very careful here. My mother has RA, go figure, rheumatoid arthritis. And of course, that's systemic acidosis. You can put rheumatoid, you can put osteo, I don't care what name you put to these things. It's chronic lymphatic stagnation. And you came out of your mama, honey. So you probably started from the get-go with chronic lymph stagnation, added on top of an almost degenerative pituitary, pineal gland. I don't know how you've even rested and got good sleep. Her mother has RA anxiety, did a heart surgery due to a stroke. That's what I'm saying. I would rather play this safe than sorry. If this isn't a tumor you're showing me, this is just ulceration, I can get with that. I would use lower circulation and upper circulation. If that's a tumor you're showing us, then I would not use lower circulation until you got rid of the tumor, because we're dealing in interstitial fluid, which is about 20-25% blood. So if you can increase blood flow to a tumor, I don't really want to do that. She was on meds her whole life, even when she was pregnant. Cortisone. Well, again, you can thank the medical community for setting your mom up like this, and then of course here comes you all set up with some serious issues. You know, this is sad stuff. It's unawareness, guys, and we are responsible for bringing awareness to this level of healing, and I really love you guys for helping me do this. Holy crap, you can see how much work we have in front of us. It's unbelievable. I have a weak tooth. I lost most in a young age. I'm surprised you have any teeth, honey. At 37. At 37, she only has like a few teeth. But you're not utilizing calcium, and you're so acidic it's going to suck the calcium out of your teeth anyway. You got some serious things you got to focus on. If I was you, I'd go 100% raw. You might want to add some green drinks before you go 100% fruit. I would add some green drinks, and I would use parsley, dandelion greens, alfalfa, real dark and green before you use them. Now we're talking. But on top of fruits, berries, and melons, don't get into the vegetable kingdom too much. You got to get your lymphatic system moving, or you're going to ulcerate your gut and everything else. You're ulcerating all over the place. Guys, this is extreme chronic acidosis. This is the top end of acidosis, when ulcers are just popping up all over you. You are frying your cells all over the place. This isn't a disease that just tripped in from Moose Jaw, Alaska. You're creating this, sweetheart, and you didn't know any better, and your mom set you up big time. She didn't know any better. No one's helping us here, but now we are. We're the way showers. You know, we're just simply the messengers. Essential. This is vital. This is a big deal, and all the masters know it too. I am doing a juice fast now, taking Dr. Morse all of the glycerin and tinctures. I got 4 lumps. Okay, I got 4 lumps on lymph node near my, is this vaginal area or something too? Something on my face, near my lips, 3 on my butt, 4 on my head. They go and come. Remember, but at least your lymph nodes are breathing a little bit. If your lymph nodes go up and stay up and get hard, breathing lymph nodes, okay, good. That means there's hope. Go after those kidneys, go after those adrenal glands aggressively. You're going to have to go after your body aggressively, dear one. I get it. At least they're small, like olive size. My diet in the last 2 years is raw fruitarian, occasional steamed vegetables. I love what you're doing that way. I went last year to Truth North Healer Center to water fast and did a blood test. My inflammation was high, so high. Well, no kidding. You have to stay with base chemistry foods. You've got it. You can't eat acid ash foods, and that's proteins and beans, grains, eggs, all that crap. No way. Vitamin D levels, for care, or less. I can't remember. They recommended to do a colonoscopy. Big deal. If a practitioner can't read this and tell you your problem, I would beg that they turn in their degree. How are you going to help people if you don't know what's going on with someone like you? And they did. I will be forever grateful for your presence. I'm happy to help you. I don't like this at all. I take these as the ulcerations. Acids can literally chew you up. You've seen some of the pictures here, and you guys that come to our school get to see some of the more gnarly pictures we have. We don't show on YouTube, of course. But Yeah, these are more serious issues. Let me just read a couple of them because the time is short here. So let me just read a couple more. But honey, you make sure you get all the help here. Jen B is taking a look at this personally too, and I'll tell her to get a hold of you. And if we can't get Marcy, she's here. We'll see about how fast we can get you in. But holy crap. These are and she's only 37 years young with 3 kids. Whew. Holy crap. These are sad stories. That's all I can say, and the world is full of these sad stories. And I point my fingers right to the stupidity of the medical consciousness and all the narcissism that implies. Vomitous. Vomitous. I'm a medical doctor. I don't want that hanging over my head. I'm going to change my ways. I'm going to learn how to truly heal people because I'm a medical doctor, and I took the oath because I didn't want the oh, well, I don't know where I'm going to find a few of those. Few. Tenderness? Let me see. Hi there. My son is 1 year and 4 months old. He has received no vaccines at this time, and it seems he will remain unvaccinated unless I am thoroughly convinced of its safety to do so. So you're going to have a healthier son? Good. Yeah, because your body has natural immunity. And remember, what they call diseases is simply stages of acidosis and lymph stagnation. That's all it is. So when you start, and the proof of that, okay, let's just say this is a theory of mine. Apply it and see what's outcome. All of you guys have been doing that. And some of you have gotten in some cool places. Incredible places of vitality and energy. Some of you have gotten rid of some of the most gnarly things. Some of you are struggling. I know some of you with Parkinson's and MS are struggling with the raw and the fruit. I get it. I get it. But it's got to have your passion. When you're in a wheelchair, you need passion to get up and walk. You can't have acceptance. You know, after a while, the medical community has no answers of regeneration. And if you keep going to them, yeah, you're going to lose your passion to be well. But come here and we're going to feed you full of passion, because passion is what you need to get up out of these chairs. And self-discipline and focus. I'm in a chair, I'm going off fruit. So what? I'm still eating, and I love the flavor of fruits and how they make you feel light and good. They clean your bowels. No more sticky, gluey poop on the butt. And everything else that implies. All right. My question is, however, about the tetanus vaccine. Could you ever recommend it? Not really. If you have a step on a rusty nail, let's say, what formula would you want to go after? Lymphatics. Those are for poisons. They'll take care of a rattlesnake bite. They'll take care of a recluse spider bite, a black widow spider. But we get them in here all the time. And they go to the medical doctor. What's the first thing medical doctors do? Give them antibiotics. These aren't bacterial problems. These are hemo or neurotoxic bites. They don't do anything for them, so you ought to see some of them. One lady came in from the hospital, been there a couple of days working on it, and I mean, it looked bad. It was a spider bite. It was this big and really breaking down tissue. Well, it took us just a couple of weeks and knocked that right out. You know, such a difference between this level of true healing and this pseudo thinking of, let's treat the body with toxic pharmaceuticals. Let's don't understand why the body has fevers and what the skin is really for. Let's don't understand that the kidneys are a part of the elimination of the system of metabolitic waste. Let's forget that there's a lymphatic or sewer system in there. Even if you weren't taught it, you could dream it. My question is about the... I've heard a child is best protected by receiving a series of 3 or 4 of them before they are too old, and I'm just referring to tetanus alone, not the DTaP. You know, well, I don't know how much this is true, but the latest is they want to load these vaccines up early on in the few months of the baby's birth. Are you friggin' serious? These guys need to go to jail for that. Let them sit in there and think about why I will not feed other people's babies toxins, especially neurotoxins, causing ADD to ADHD, ADD to become rampant, and seizures all over the place. What you're seeing in today's world of these extreme cases are big partly due to the allopathic community and the way they treat. They forgot the simplicity of what causes all these things. I would love to hear from you on this. I trust your opinion and your experience is the best information I can find. Oh, thanks. But I'll tell you, Stephanie, the lymphatic formulas are so... I mean, when you've got bloodroot that'll pull a tumor right out of your body and heal it right behind it, cool. But understand that when you start playing with the acid side of chemistry, don't get upset when you get burnt and bit. Just saying, you paleo people, when you wake up someday with extreme bowel problems and high acidosis in the body, don't be surprised. You just got bit on your very ignorance of proteins. And quite frankly, I hope you guys don't fall into that, because when you're advanced, like with all these like chronic and degenerative changes, and you do proteins, you're going to put yourself in a position of hard to get yourself back. See, if you keep taping yourself too far out in left field, we'll reach deep and grab you, but we can only reach so deep. You know what I mean? All right. Dear Dr. Morse, I thank you for your time and knowledge with putting your videos... thanks, man. Well, I have fun with that. I'm feeling a little energetic the next few days. I've been on these Concord grape fasts and stuff, so watch out. I'm building. I'm trying to balance, but I'm building. Yeah, thanks. Well, this planet needs truth, my friend. My dear one, we are in a sad state in the Homo sapien state. And the Homo sapien can be a beautiful species and experience some higher levels of existence among each other and the camaraderie that can bring. But at this time, we are a serious threat to our own selves and the animals and plants to the planet. I am a 37. Oh, I just read a 37. Look at all the 37-year-olds. I am a 37-year-old woman with bone-like growths along the edges of where my tongue rests in my mouth. Mandibular Torah. It's really bothering. No kidding. Bone-like growths along the edges of where my tongue... Is it on the tongue? Or on the palate and things? It's really bothering me because I've heard the only way to get rid of it is get it clipped off. Oh! Ow! Yeah, use a toenail clipper. Ow! Okay. Please advise on why I have it and any herbal recommendations as well as how to heal my mouth. I have a feeling it's from the past cheese obsession. Yeah. That's the point. Absolutely. You know, when your lymph system gets so backed up, and especially with the cheeses and stuff, you've got a lot of fungal problems. So you can get all kinds of warts and growths on the body, hardened stuff, skin tags, all kinds of... Under the acid sky, you can get all kinds of abnormal growths, but especially when you're highly fungaled up. And I don't know, look at your eye and see if you have sulfur in the gut. You could have extreme fungal problems. But you remember the mouth is just is the extension of the gut. This is a big part of the body is a food processor, and it starts right here. So the more acidosis you see, the more growth you see, the more parasitic issues you see, because you're creating sewage and breaking down cells, and that's a call of the wild. Whenever you break down any tissue, who's going to come to the rescue? Exactly. And if you look at that and you kill your microbes that are simply trying to help you, you're unaware of what's really going on in life. So my point is why I say the regenerative detoxification is the golden key, because that's the doorway you have to go through to start opening up these eliminative organs and start getting hydration going. You're coming in here with high electrical alkaline slurries, and you're getting the herbs are getting the tissues more functioning better, because herbs are for structure and function and also cleansing. So by doing all these things, opening up the elimination, getting hydration to these interstitial spaces, you begin to move from this cationic environment into this anionic environment. And then things start moving, you start breaking down from being hard and stiff, you get more pliable, everything feels better, and it just keeps getting better, and better. I don't know of anybody that's reached the top of it. Could be dangerous, especially for undisciplined humans. Most humans are very undisciplined, particularly emotionally and mentally. You can't give them too much power with that, because you see what the medical community does with too much knowledge. that is of the pseudo kind, yeah, dangerous. That's what I would do, cheese obsession. But know that you're full of fungus to have the cheese obsession, honey. But you know what? Get in, detox that gut, go after that GI tract. Get those kidneys filtering. Get on the adrenal kidneys. Get those kidneys filtering so that lymph can move and hydrate. Start raking and cleaning that bowel. GI broom, stomach and bowels. Make sure you're having daily BMs. Go after that gut. And I would do a little parasitic kill. I do Parasite M and Parasite G both for about a month. Or a month and a half. Check your stool, see what you see coming out. Because if you got bigger boys, you will see them coming out. On the herbs, they'll probably be dead, but you'll still see them. Whenever you get good, because we get pictures of them from you guys. Whenever you see them, take pictures. You always want to deworm yourself. If islanders can do it, we can do it, right? I can tell you story after story after story. Nasty stories of moving the parasites out of the body. Well, thanks. I really am humbly appreciative to each and every one of you for spending your sweet, precious time watching these videos. But I hope they do you some really good. It's time for us. And so, this planet is suffering quite a bit. And even though I beat up the medical community, we need changes. You can't follow the same path that we've been going because the humans won't exist. So it's time to uplift the human race. And I extend my hand to all medical physicians that are willing to grow and learn how to really cure people. All the other physicians of all modalities, come join us. Let's develop a powerful modality of our own that shows this world what the higher levels of healing can do to your world and give you a much greater journey here where you have happiness instead of depression. At 8 years old, depression, anxiety, you couldn't hardly breathe as a child. This poor lady has suffered, and all very fixable. All very fixable when she was a young child. Even the mother is fixable. What about the mother? She's suffering if she's still alive. These are all very fixable. So, I like to fix things, don't you guys? I didn't go into a world, fix it up, make it nicer than when we came, and then leave. Here, it's better. Here, take it. You guys run with it. Go on to the next world. We're way showers. We're messengers. That's what we do. We travel from world to world. Well, some of us do. Fun stuff. Fun stuff. And you guys keep growing spiritually because you guys all have the ability to visit other friends through your other bodies. Remember that. You guys have abilities that you're opening up to that is fantastic. Incredible. Yes?
Yes.
See? Thank you. Love you guys.